Thank you. A little bit intimidating. You guys are so great getting out here on a Saturday morning. Okay, and yeah, Kamal gave me a topic that I actually find challenging. I do a lot of disease care and illness care, and when she said, I want you to talk about the joys of caregiving, you know, I thought, yeah, I remember when I was caring for my dad, and my brother, flew in from Connecticut, and was like, how come you're not giving him a shower in the shower? And I'm like, well, Jeff, it's kind of hard. He goes, no, he would really enjoy that. And 5 hours later, when the bathroom is flooded and we have used every towel in the linen closet and my dad is exhausted and I have a wet wheelchair that's not supposed to go in the shower, I'm like, we are never doing this again. And I thought, okay, joys of caregiving, joys of caregiving. And then someone just came up to me and said, oh, the joys of caregiving are when, that just means like the family flies in more often from the mainland. And I thought, no. The joys of caregiving is when your sister from California doesn't come to help. So, but then I'm driving here and my sister-in-law, who's married to my brother, who never has time to answer the phone, answered the phone. And we got to call, and I said, oh, I'm sorry, I'm in a rush. I'm going to give this lecture on the joys of caregiving. And, it's kind of hard for me to think. And she says, I might be different. And she cares for her dad. She cared for her mom who had Alzheimer's. Well, the dad cared for the mom, and she kind of helped them out both. And now she cares for her dad, who's in his late 90s and is pretty good but needs some help. And she said, I don't really do that much for him. I said, Carol, I think you do a lot more than you give yourself credit for. And she goes, he's really wonderful to take care of. I'm like, it doesn't mean you're not doing stuff. And she said, well, actually, there's so many good, and this is unprompted. She said, there's so many wonderful things about caring for him. And she said, I've really gotten to know him on a deeper level. And she's always had a really good relationship with Jim, her dad, but that was wonderful. She says, he has so much more wisdom than even I appreciated. And he's always been Mr. Mellow, Mr. Nice Guy. My brother, if you can glean from the previous story, has a certain personality. And so she said, now having her dad in the house brings a level of calm to her home that she doesn't and Jim kind of helps to keep my brother in check a little bit. And Jim had been the one that cared for his parents, so Carol's grandparents, all of Jim's siblings. He's the last one. He's in his late 90s, so everyone's passed before him. And then Carol's mom, who had bad Alzheimer's, and that was, it's sad when anybody gets that disease, but she had been a woman mathematician years before, that was an accepted or, practice. And so she said, I'm so honored to care for him. And I'm like, you're making me cry on my way to give. And those kind of stories is what made me feel like my sort of baked in sort of disease-minded, what are the diseases associated with caregiving? And her, this is the joy and honor of my life, made me feel like my theme is Joni Mitchell's song, Both Sides Now. So, which also makes me cry, right? Does anybody remember the song?
Flows and flows of angel hair and ice cream castles in the air and feathered canyons everywhere. I looked at clouds that way,
Right? So it's the
but
positive
now
of
they
everything
only block the sun
and the
They
negative.
rain and snow on
So-
everyone. So many
And then she talks about clouds. Should we just listen to the song, even though I have to listen?
I've looked at clouds from both sides now, from up and down, and still somehow it's clouds' illusions I recall. I really don't know clouds at all.
Okay. So, and then she goes on, and the next part is love, and, you know, the positives and negatives of love, and then the positives and the negatives of life. And we're going to add we're going to call Joni, and we're going to say, hey, can you write another verse? Because we want caregiving as one of the verses of that song. And, you know, it occurs to me that by the time someone needs a caregiver, nobody goes about life thinking like, I want to be at the point where I need someone to help me, you know, put my socks on, or, you know, help me take a shower. So somebody is in a chapter of life that is not their optimum, and you as the caregiver, you're the rainbow in somebody's cloud. So, okay, so today we'll talk about both sides now. And I don't know if anybody was here for my last lecture. It was okay. It was constipation. It was also hard to think of what's an image that you can show. And I thought, I can't really show more pictures of dogs pooping. Okay. Sorry, I thought someone had a question already. So we'll talk about everything. And Rosalind Carter, remember Rosalind Carter was a great, no matter whatever politics you have, a great woman, started an institute for caregivers. I'm not really sure, and so sorry. Oh, I'm supposed to talk into the mic. I can't stand still. Okay. Anyway, Rosalind Carter said there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And actually, in the end, you'll see that she has this foundation has a nice website, and there's all sorts of information for caregiving, and it can be one of our resources. If you're a caregiver, if you're a caregiver or if you've needed a caregiver, I don't know if I should even ask that question to the audience. I'm going to assume, based on this crowd, that many, many people at one point or another have been caregivers. And I will assume, based on my own situation and that many of us at some point have needed a caregiver. I can tell you that 2 weeks ago, I took my partner Britta's daughter to Honolulu Theater for Youth. It's so cute, it's so wonderful. And I took her 5-year-old to go see a really cute little play, but I didn't realize, like, they shut the door and then you're locked into this room with, like, just everybody with a green 11. They're all, you know what the green 11 is? Does anybody not know what it is? Turn to your neighbor and explain it to them. Oh, the green 11, it's when little kids have green snot, running down both nostrils, and it's just like it's just, and they don't even, and then they touch you, so 2 days later I had 103 fever, and they got me good. They were thorough. And I was so sick, and I had to call my adult daughter who lives, in Hawaii, and say, you need to come because I don't trust myself to walk from the bed to the bathroom. I'm gonna pass out. So she came and she cared for me for a day, and I'm like, I don't know what I would have done. Anyway, the importance of caregiving. That is so common in the United States right now. I mean, that was an acute, short-term thing, but you can see from these demographics that, like, more and more and more, 2015, 43.5 million Americans were providing unpaid care to family, friends, or loved ones, and by 2020 it was 53 million. Now we're at 2024. I can't even imagine, I just would imagine the number is, way closer to 57 million. So today's topic, by the way, just to clarify, I am going to be talking mostly, the data that I have is about unpaid care. So this is not like, oh, I work as a nurse, I'm a caregiver, or I get paid as a doctor or a physical therapist. This is about family members, loved ones, girlfriends, boyfriends, grandchildren, children who are caring for somebody in their family. So 1 in 5, and these are people that also have jobs. So the Rosalind Carter Institute collected data, and 1 in 5 full-time workers is also caring for somebody with a serious illness or disability. So my sister-in-law, Carol, is a full-time magazine editor. Yes, magazines still exist. Don't look at me like that. Probably won't by the end of this talk, but 20% of them had to quit their jobs in order to be caregivers, and 40% said they had to go to part-time work. What kind of things are we caring for? You can imagine. People with cancer, people with dementia, mobility issues, and there's a lot of gaps in the support that we also give to caregivers. The things they need are often not being filled. If anybody here has been a caregiver, I'm sure you've had to navigate insurance kind of issues, and you find out, what, Medicare doesn't pay for that? Medicare doesn't pay for that? Medicare doesn't pay for, yeah. So caregivers may be doing something for the very first time. As a geriatrician, I see a lot of wives mostly. I'm going to shake my finger at, I'm shaking my finger at the 1950s, because that's what, wives who said, I never did the taxes. And then he had a stroke. And now I had to learn how to do the taxes. Or I don't know any of the passwords on the computer, he never showed me. Is a very common, or sometimes people say, I didn't have any siblings and I never had to, this is the first time I've ever had to deal with end-of-life issues. I don't know what I'm dealing with. I've never, done this. I don't know, how to find the paperwork for, Medicaid, whatever. And as healthcare providers, we're not really great at having that conversation with people. I did give a similar talk. Kamal and I gave a similar talk, but it was more medical, and it was more like doom and gloom, and and then the planet's going to burn up kind of lecture. And basically we talked about the health risks, and I'll get to that, of being a caregiver. And we had an audience full of doctors. And after talking about the health risks, I said, so if you had another condition that had this kind of health risk, like smoking, or driving a car without a seatbelt, wouldn't you talk to your patients about it? Or cholesterol? How many doctors in this audience have asked your patient if they're a caregiver? Anybody here, raise your hand if your doctor has asked you if you're a caregiver. Yeah. So it's very rare that doctors think about people's roles as a caregiver. They ask you if you're a smoker. They ask you if you're a drinker. They ask you if you get exercise. But are they asking you if you're spending 8 hours a day helping another person in and out of the bathtub? And a lot of stress comes from the fact that if nobody asks you if you're doing this, how are you going to get support for it? And very, very few people went into caregiving thinking, I'm going to do that, like this is a part of my life plan. It's generally not part of a life plan, and many people even feel that they don't even have a choice. As much as my sister-in-law Carol loves caring for her dad, she would admit that she doesn't feel like she has a choice, right? her other sister, Annie's flaky and already cares for her useless boyfriend. That was not my opinion. That was a lab test that came back. Yeah, we were shocked. Yeah. It's hard for him to get a job, because he's picky. Yeah, so whatever. And her other sister has like a kid with special needs, blah, 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 right? So many, many caregivers, when surveyed, are doing it, but feel like they didn't have a choice, and it's a feeling of loss of control in your life can often lead to stress. So caregiving can often lead to stress, and often people will say taking care of their relative, 23%, I get to use my little pointer? Yeah, feel like it's made health worse or made their level. Very rarely did people say that caring for a relation has made their health better. Although it's nice to know that like 72% said it really didn't affect my health right before they had a bleeding ulcer. Sorry. So there's also the emotional stress of caring for somebody. And when asked how emotionally stressful is it caring for your family member, 19% was stressful and 18% very, very stressful. So if somebody wants to do the math for me, here it is, 36%, look at that, because they know, like, standing on my feet, I can't add these two numbers. But 36% said that they had high emotional stress, and many felt that they were very alone in that feeling. There's the physical strain, because oftentimes we're doing physical labor for caring for others, and 17% said they had a high level of physical strain. And so that's why, like, we don't have dogs pooping, we have the lightning and dark clouds. Just need to, and financial strain, right? We already talked about people having to give up their jobs, or go to part-time work, or it costs more. I remember when my dad passed, and he passed in hospice. I talk about my dad a lot in these lectures, so if you've come, you've heard dad stories and dad jokes or from my dad. But I kept saying, Dad, he had cancer, and I'm like, I think we should sign up for hospice. His cancer was not really amenable to chemotherapy or anything. And I said, and he's like, no, I'm not doing hospice. I'm like, well, I think we'd have benefits, like, and they would send a nurse, and no, I don't need hospice. I don't need, like, yeah, that's what I also said about marriage counseling with my mom. I don't need nobody. I'm like, okay, yeah. We've been married for 53 goddamn years, and I don't need anybody. I'm like, yeah, okay. You might want to, like, examine that, So, finally, like, he was like, all right, you can, if it's so important to you, like, get hospice. So they come the first day, and they brought big boxes full of Depends and Chucks, that you put on the bed. All the things. My dad's like, oh my God, this is great. Like, that was his idea of hospice. Free Chucks, free diapers. And he was so excited about hospice. I'm like, okay, it's not really the. And then he started, like, hoarding all, like, he'd hide them under the bed. And he was like, oh, we're all out of Chucks. And he's like, look at this is great. I'm like, okay, but it was real, Depends are expensive. And it made him happy. Okay, that's what made you happy, Dad. But caregiving, even, like, things like that, it's expensive, I can't even think of, you guys are nodding, like, you're thinking of expenses that you never thought of, hiring respite care, or, adult daycare, or Depends, or new equipment, or, who knows what, And because of this, we hear in this, stress is dangerous to your health. And if you're a caregiver who's stressed, there's real health implications. And lots of research now has been done on if you're a caregiver who's experiencing stress. And I think, Kamal, weren't you part of the HERS study? Not this one. All right. Every other study. I picked the one you're not part of. But you're in the HERS study, right? No? Okay. Anyway, you studied it. Yeah, she was, okay. Not, okay. So looked at the relative risk for getting heart disease or stroke if you're a long-term caregiver, and you can see that this relative risk means that it's almost like double the risk if you're a long-term caregiver as opposed to being like a non-caregiver. Oop, did I just go forward? Let me just, yeah, okay. And here's a different study that looked at dementia caregivers versus non-dementia caregivers versus non-caregivers, and the caregivers who report having a chronic health condition. So here's your non-caregivers. And you can see if you're a non-caregiver, your risk of having a chronic health condition is 3.2. And if you're a dementia caregiver, it's 5.2. Or if you're having heart disease, non-caregivers 6.6. Non-dementia caregivers 7.2, which is already a big increase, and then if you're a dementia caregiver, 8.3. So over a big population, you can see that it can have higher actual health risks. Here's another study that looked at in 4 years the risk of being a caregiver compared to a caregiver that doesn't report stress or strain and being a caregiver with strain. So basically you have a 63% increased risk of dropping dead in 4 years if you're a caregiver who says, I am stressed out, versus a caregiver who says, no, I'm not stressed out. So it's important for us to ask the question, are you a caregiver? Are you a caregiver who's having stress or strain? Are you feeling the burdens of being a caregiver? Are you getting burnt out? And here's, lately there's been more focus on this, right? And if your doctor hasn't asked you, you can feel free to say, Dr. Kogan said you're supposed to ask me if I'm a caregiver. And there are tools, but seriously, just ask the question. Doctors like to hide behind screening tools, and insurance companies like to give us credit for checking boxes and stuff, but really just asking the question is the first step. But it's good to use these screening tools because then we can collect data and show that yeah, if you score, an 8 or more on a, ooh, where'd my little dot go? Dot? Okay, dot's gone. Oh, bye, dot. Okay, anyway, it's important to recognize that there's very, very positive aspects of caregiving. And you saw that there are ways, and some people have experiences of caregiving without strain. And hopefully some of you are here today thinking, well, I'm the caregiver to my husband, or my father, or my brother, and we have a great time. I love it, And clearly my sister-in-law, Carol, loves that Jim, that's her dad, is in the house. He's actually way more pleasant than my brother, who is a, okay, yeah, he is. So there's definitely positive aspects. And has anybody heard of the blue zones? Okay, you guys probably had lectures on the blue zones at some point or another. What were the, okay, so for people who don't remember the blue zones, it's areas in the world, basically, or the zones, where people tend to live well into advanced old age, into beyond 100, and generally have very high quality of life and report very good, outcomes, health outcomes, life outcomes. Do you remember the common elements that they found that were super important in the blue zones? What were some of the things that made the blue zones a blue zone? Social connections, physical activity, any more? Any others? Diet, healthy diet, mostly plant-based diet. There she is. There she is. Yes, most of them did, except for I think one community, which was Seventh-day Adventists, and they're abstainers. But wine in moderation. Yeah. Moderation's a funny term, right? Yeah. Moderation depends on how bad your day at work was. So, yeah, I am a non-drinker because I'm a cheap date, as they say. So, yeah, and what was one of the other things that they found? What was purpose? People felt in these zones that they maintained a sense of purpose well into older age. So one of the most important findings, so now finally we're starting to get some research, some studies about positive aspects of caregiving, because it's going to be it already is super, super important, and it's only going to become more important. And one of the things that people who were caregiving with a positive aspect of caregiving, a PAC as it were, people who had a positive aspect of caregiving, many of them reported, I have a sense of purpose, right? And I think a lot of us in this room, people in this room you didn't just wander in here off the street. You're highly successful, you're highly educated, you're highly connected in your community, you are people who pursue continuing education, you pursue, you're an elite group of people, and I would imagine that even without striving for it, because of the way you've led your lives, you have a strong sense of purpose. And many of you probably were in careers or family situations that gave you a sense of purpose, right? And many times we see a lot of the men in this cohort of people, like when they quit their jobs, have a big health crisis or something, because many times career was their sense of purpose. They were, something that connected them to the community or something that, right? Thank you, James, for backing me up here. And I'm having that now. I'm at, retirement age, and when I think about that, I'm like, but this gives me my raison d'etre. This gives me my reason for living. People say, oh, you had kids, though. And I'm like, oh, screw those ingrates. This is my, you know what I mean? This is what gets me out of bed in the morning. And having, being a caregiver often is people's sense of purpose. Even if you look at their life and you think, oh, but you're, whatever. It's this is, what makes them feel that there's meaning in their life. So, which is then super important. It's not just oh, isn't that cute? We know from the studies of the blue zones that purpose actually is biologically protective to you. So, and there's many, many other positive aspects of caregiving that you can see that when caregivers have a positive experience of caregiving, they're actually biologically protected then when, right, because we looked at that study, right? Do I need to go back? Are you looking at me blankly? Yeah, wait, here we go. Like, you can be a caregiver with strain, or you can be a caregiver without strain, and you have a huge difference in actually dropping dead, which is like basically the summary of all these other, like, like, oh, did you have diabetes, cancer, obesity, right? Like, we sum it all up by saying, how quickly did you pass away? So we know that having a positive aspect of caregiving is actually associated with better health outcomes. And many people who are caregivers actually find that they have at least one positive aspect of caregiving. 73% said, yeah, I've got at least one positive aspect of caregiving, if not more, right? That many people found companionship. Many people found caregiving fulfilling or rewarding, that they enjoyed it, that it satisfied a feeling of duty. And I think that's like my sister-in-law Carol felt like, no, he did this for everybody else in the family. This is my time to do this for him. 7% felt it improved their quality of life. And I think because Jim kind of is like the human meat shield between Carol and my brother, because my brother's not going to be really mean to Carol when her dad's in the room, that it actually improves her quality of life. And 6% just said overall, she likes that human meat. Yeah, hate to do that to poor Jim, but that's his purpose, Yeah. So anybody know who this guy is? Bob Ross, right? We're going to paint a happy little cloud over here. So he paints happy little clouds, right? If anybody hasn't seen Bob Ross, he was this odd little duck who paints pictures on videos, and he talks about it. And I don't know, was this back in the 70s or the 80s? I mean, the hairdo looks like, yeah. And he had this hipster resurgence. And so now young people, so I went out, this is a while ago, but I took the youngest one, my daughter, out to Smith & King or King & Smith. They make this really good burger. Don't eat burgers, they're not good for you. But anyway, and on the video screens in this hipster bar are Bob Ross videos. So he's become hip again, but he paints happy little clouds. And that basically research has been conducted that says when caregivers view their experience as rewarding and satisfying, that they actually cope really well. And here's a happy little cloud. And when they have higher positive aspects of caregiving, when they have that I find meaning in it, or I feel like it fills a sense of duty, or I find, it enhances my quality of life, caregivers have lower depression and anxiety, and they're also less affected even if the person that they're caring for has behavioral issues. So even if maybe you're caring for somebody with dementia who keeps, doing some bizarre behavior, which is what people with dementia often do, the caregivers who said, no, I find purpose in this, the behaviors don't affect them as much. I don't know, I'm just a poop person, and we had a patient who kept taking their feces and rolling it up in toilet paper and hiding it outside the window. And I know, and I think because they didn't remember what to do with it. And I think that if you're stressed out, you can be like, oh my God, there was a terrible smell in the room. I couldn't figure out where it was coming from. And now there's all this poop on the roof outside the window. But if you have a sense of enjoyment, it's a funny story. And that's my philosophy of life. Personally, I'm like, you either have a good time or you get a good story. Hence 5 hours in the shower trying to get my dad, into and out of a shower. I'm also the one who told the story of dropping my mother in the bathtub when she was naked. And, obviously she was naked, we were in the bath, and then falling into the bathtub with her and not knowing how I was going to get us both out of it, and thinking, if someone has to call the fire department, at least they're going to find something really funny. Okay, so having any positive aspect of caregiving, finding the happiness in the clouds is associated with increased morale and it's another study from a different researcher. And I think this is kind of like not a given, because sometimes we have to put loved ones into facilities for reasons that are, obvious and clear, and but people who reported more positive aspects of caregiving were less likely to institutionalize. I wrote BFF because there's no really good word in the literature for who we care for. Carees, loved ones. That's not really always appropriate. They're not patients. My dad was not my patient. He's not my client. He's not my. So he was my BFF. He was my person who needed help. Anyway, there aren't as many studies on the positive aspects of caregiving as there are. Okay, and I know we're going to quit 10 minutes early. Do we need to quit now? In 5 more minutes. Okay. But there are more studies being done. They're developing more tools for testing positive aspects of caregiving, and there's more emphasis on it. And I think it's important. It's great to have a positive aspect of caregiving, but like most things in life, it's not dropped into your lap. And we do need to be a little intentional about the things that we want in life, right? And so here's tips for family caregivers that are meant to sort of move the needle towards more positive aspects of caregiving. So I'm calling it tips to polish the rainbow. And I think anything that you've wanted in life, generally you had to do something for. Guys, you saw that really cute girl across the room. You didn't wait till she came to you and said, hi, I see you've been staring at me with your mouth hanging open for the past, you had to get up, you had to cross the room, you had to ask her to dance, or you had to introduce yourself. And ladies, you had to give them your phone number. So you have to do stuff for what you want. And so this is the way we're gonna do it. First of all, seek support from other caregivers. You are not alone. 53 million Americans. It's like if you took all of Hawaii, multiplied it, everybody in Hawaii, multiplied that 53 times. That's how many people in America are caregiving for loved ones right now. So there's other people are gonna have tips and tricks, and you're gonna have to get what you can from everybody. Everyone has something to share. Not always something that's going to be helpful to you, maybe not today, but maybe tomorrow. So there's support groups, there's your religious institution, there's the Alzheimer's Association, there's Parkinson's Association. Locally, we have Project Dana, which actually sends out friendly visitors to do companionship, and so there's places to look. Take care of your own health so that you can, right, when you're on the airplane, and what do they say? In the event of an emergency, oxygen masks will drop from the ceiling. What do? Put it on yourself first. Put it on yourself first. You can't imagine how many people, when I give this lecture, argue with me. Oh, but you really should. But no! Take care of yourself so that you're not burnt out, so that you're not angry, so that you're not resentful, so that you're happy. Wake up and give yourself your cup of coffee first. you know? And then you're ready to face the day or do the crossword, whatever you do, right? Schedule your own doctor's appointments, your own grooming, your own downtime, your own whatever you need. Take care of yourself first. This is not selfishness. This is not selfishness. Can we say it together? This is not selfishness. This is necessary. This is necessary, right? So let's practice coming up with things that people can do to help you. And let's practice saying yes. Mitzi, is there anything I can do to help you? What can I do? Thank you. Right?
Wash the dishes.
Wash the dishes. Ricardo, is there anything I can do to help? You don't know. We need to practice. Ricardo needs some help practicing. That's why, or maybe he doesn't have faith in my abilities to do anything, which you got to respect that. That's why men tend to die quicker than women. Sorry, but they do because they're not really used to ask. So here's a couple of suggestions. Somebody says, oh, you're so busy caring for your sister. What can I do to help? What do you see here? Say, yes, can you wash my car? People would love to do that, right? Can you, bring over a casserole? Bring over, can you sit with my mom so I can go get my hair cut? What else? Come on, give me 5 more. Clean my house. Thank you very much, right? And that's something people would feel like, yeah, and it's discreet, it's done, it helps you. What else? Can you pick up groceries for me? Anything else? Yes. Yeah. Can you visit me? Oh my God, you're gonna make me cry, right? You become invisible, right? And can you spend time and ask me, where I got that dress or where or if I've seen any movies or read a book or tell me about a book you've read. Yes, thank you. I think a good thing to do is learn how to communicate effectively with the doctor. I used to tell people, when you go to the doctor, bring a 3x5 card, hold it in your left hand, and it has the 3 important issues that you really need the doctor to address. And when you walk in the room, shake the doctor's hand with your right hand, don't let go, then hand him the card. Because otherwise the doctor, and if it's a telemedicine visit, do it in the beginning of the telemedicine visit. Otherwise the doctor goes into every visit with you with their own agenda. And in their mind, they know, okay, I want to talk about your high blood pressure, I want to give you your lab results, I want to, and if you don't make time in their agenda first, you're not getting in there. See if there's ways to get respite so that you can see your friends, you can get your hair cut, you can get, if you're experiencing stress or depression, get help yesterday, get help now. This, in the old days, depression was seen as a weakness, there's something wrong with you, blah, blah, blah. Nobody thinks that anymore, it's not a thing. Get help. There's really good ways of getting help. Be open to new technology. If it's really hard to get your loved one in a car, try telehealth visits. Try different things. I'm just going to make a push for having all your legal documents in a row. It makes it a lot easier to be a caregiver. If before things got too advanced, you got a power of attorney, especially a durable power of attorney. I mean, the healthcare stuff, I'm supposed to say it's really important. Less important than the legal stuff, than the financial stuff. And please give yourself credit for doing the best you can in one of the toughest jobs there is. So that's for you. That's for you as a caregiver. So on my slides, there's some resources. Does anybody have any, oops, sorry, Kamal, questions? Do I have time?
Thank you, Shari. Yes, we do have a few minutes for questions. Oh,
And I might crowdsource for answers because, like I said, caregivers are the best helpers for other caregivers.
Well, my daddy lived with us for 10 years, and I had two brothers, and at the very beginning, we had a really important talk, because he chose to live with us. And we had to talk about who is going to be the decision maker. And we made it clear at that very beginning that since he was living with us, that Bill and I had to have that authority. And were they comfortable with that? And they were. They said, because we'd know more about what needed to be done. But I think it's really important to have that type of discussion early in the caregiving.
That is a great, great point. Yeah, in the literature in geriatrics, we have a phrase called the daughter from California syndrome. And it's like the daughter who's living here has been taking care of mom and dad for years and years, and then her sister flies in from California, stirs the pot, makes everything like, and then like, you know, demands that everything be different and then leaves. And it's very stressful. Like, yeah, figure out who's actually the decision maker and support that person. Yeah, somebody.
I have a question on behalf of a attendee whose voice isn't doing so well. The question is, there are different types of caregiving. Those who do all the hard work, like bathing, feeding,
Yeah.
staying overnight with them. Then there are others who are family members who hire and supervise professional caregivers. What's a name for these people?
Oh. You know, I don't officially think there's a different name. We could come up with a name ourselves. This is all so new. But actually, all of that's important. Certainly, the back-breaking physical labor and the staying overnight is exhausting. But caregivers who are just in charge of, like, balancing the checkbook and hiring the caregivers and make the hired caregivers and making sure people show up on time, and you have to give yourself credit for that too. So I guess there's the supervisory caregiver. I don't know. I'm sure someone's going to come up with a better name than I have. I think we're still struggling with the names for all of these different kinds of roles. The coordinator, I like that one. The navigator, those are great words. Yeah, and I think both of them have their stresses. Yeah. Yeah, any other?
Yes. I found out that a lot of caregivers won't seek help because they think they're the only ones that can do this.
Okay, yeah.
I need to do this. The person only needs me. And I found that out to be a lot of people think that way. Also, you should not feel guilty when you get angry in caregiving. I mean, you're only human. Everything has been taken away from you. I don't care what institution or who says it, you do have those periods when you get angry and say, why me? I wish I didn't have to do this. Don't feel guilty. It's a part of being your life and a part of being a human being.
I think that's a really, really helpful thing to say. Thank you. I think even like, I don't know if anybody had this experience, but before you have your first child, everyone says, oh, childbirth is so beautiful, and oh, it's so exciting for you, and it's so wonderful, so that when you go through the horror show of like having a baby, and even for the husband or the father who's looking over and going, what the hell? And that ugly, slimy purple thing comes out of you. And then it's a screaming poop machine, and you're feeling like everybody else had this beautiful experience, and everybody else is so happy with their new adorable baby, and why am I the only one who's, you know, exhausted and angry and thinking, what the hell? And so I think it's important that we're honest with each other and go, it's not all like bunnies and butterflies, you know? And whatever relationship you had with that person doesn't go away when you become the caregiver. Like, so if you've had like a relationship where you do get angry at each other, or you do, and like, who doesn't, you know? Maybe my friend Carol, who cared for her mom who had Alzheimer's disease, who one of the things they left out is humor, I'm gonna say. Like, nobody studied humor in caregiving. And Carol had a funny story every day, but that's the relationship she had with her mother. So her mom was really crafty and everything, and they had tons and tons of grandkids. And so they're doing another baby shower. This is just one of my favorite stories that always sticks in my head. And so she got her mom to do like tying all these little washcloths and diapers to make them look like cupcakes. And they made like 100 little cupcakes. And then her mom turned around to like go have a cup of tea. And she turned back around and she said, "Oh, those are wonderful. Who made those?" So, you know, Carol always had a funny mom story. But like with my dad, like we always like, you know, we had what I thought was a normal relationship. And my brother and after my brother stayed for a month, my brother said to my dad, "Dad, I'm getting on a plane to go home today. And I swear to God, if you die when I am on that plane, I'm going to be so mad at you." And of course, my dad died when he was on the plane because that's the kind of relationship that we have in our family. You know, I literally will die to get the last word on you. And so I think, like, yes, and like, no, like, don't think that everybody else is having like cupcakes made out of baby diapers. Some people are literally like saying, "Screw you, I will die when you're on the plane," because that's the way, you know, and it is like any kind of emotion that you're going to have with life, you're going to have. It's okay. If it's persistent, please get some help. Nobody wants to feel angry every day. And it might be a reason why maybe you need to look into maybe putting someone in an institution, in a facility, because that's gonna wear away at you. But a little bit of anger is, I think, for me, I'm gonna say normal and even funny. Sometimes I still think it's really funny that my dad did that to my brother. I think it's hilarious. And I think in heaven, my dad thinks it's hilarious too. Yeah. And I think, you know, taking care of maybe somebody with Alzheimer's, sometimes it's like, it's okay. Sometimes you have some anger and then like, good, you know, it's Groundhog Day. You get to start again, you know. But thank you. Yeah, like sharing that, like sometimes it's not all perfect is also good. It gives you a sense of like, okay, it's not just me. I'm not a bad person. You know, anger happens or sadness happens. But also like really funny things can happen and you can give yourself permission to actually laugh at stuff or enjoy it or, you know, find what's meaningful to you, but you may have to be intentional about it. Like, you have to say yes when people offer help. Even if you have to take the drive home while somebody's driving and write down 5 things, even if it's hard and feels weird. If you believe in heaven, right? I don't know. I don't really believe in heaven, but I sort of believe like you have to do your good deeds on earth just because your mother expects that. So you have to do your good deeds on earth. People are trying to do their good deeds. Can you give them a little hand? They say, "Can I wash your car for you?" Just say yes. Or is there anything I can do? Say yes. And then give yourself a minute to say, let's figure out something you can do. And then you get a chance to say thank you, and they get a chance to go to heaven. It's a win-win, right?
Thank you, Shari.
All right.